Greetings, my name is Coralai Konartai, and today I am going to present the video abstract of our manuscript, which is titled The High-Grade HPV Prevalence Trend Among Women in Astana, Kazakhstan, 2018-2022 cross-sectional study. So the worldwide incidence rate of cervical cancer estimates 13.3 cases per 100,000 women. The burden of cervical cancer remains high in many parts of the world, depending on substantial geographical and socioeconomic factors. The incidence rate of cervical cancer remains high among Kazakhstan women. Estimated incidence rate of 18.2 per 100,000 women. So the cervical cancer ranks as the second leading cause of female cancer and cancer-related deaths among Kazakhstani women, with estimated 1,777 new cases and 834 deaths reported annually from cervical cancer. Approximately 80 to 99% of all cervical cancer cases have been linked to human papillomavirus. So the main aim of our manuscript is to analyze HPV type diversity among Astana women. So the new data acquisition will establish the database on the prevalence and distribution of HPV genotypes among different areas before HPV vaccine implementation by providing the crucial information for decision on the HPV vaccination and cervical cancer screening programs. So the study design of our study is a retrospective cross-sectional study. So the inclusion criteria for participants was female patient attending the Olympus laboratory in Astana between 2018 and 2022 for HPV DNA testing. The age of participants ranged from 18 to 64 years. After that, the cervical smear was sampled from these patients, and further the HPV DNA extraction was performed from the smears, and using the AmpliSens Real-Time PCR kit, the 14 HPV types genotyping was done. Then the statistical analysis of obtained data was performed using the Stata16 application. So as a result, for 5 years, out of total number of participants, 43.68% were infected with high-risk HPV infection. Among these positive samples, the most prevalent types detected were HPV-16, with estimated 20% incidence. HPV-31 was found in 90% of participants, and HPV-52 and HPV-51 and HPV-39 was estimated as a 8% for 5-year period. So this current research represents the first large-scale study conducted in the Central Asian countries analyzing data for the past 5-year period. So this study revealed that HPV is relatively common in Kazakhstan, and epidemiological data on HPV prevalence in Kazakhstan region can specifically contribute to HPV infection mapping. So prevention efforts such as HPV vaccination and regular cervical cancer screening are important for reducing the burden of HPV-related diseases in the country. So these findings of our current study provide the crucial information as a basis for future comprehensive study, particularly after the implementation of the vaccination program in Kazakhstan in 2024. So thank you for attention. Feel free to ask any questions that you have by contacting our emails. Thank you. Goodbye.